Medical Sciences and the MD PhD program. Our innovative educational model sets us apart, creating a transformative experience with educational partnerships around the world. 8 research groups with strategic focus and over 50 educational partnerships worldwide. We have been ranked in the top 5 in the last few years in the national exam for medical residency applicants. National accreditations support our programs endorsing our training. We are the first private school with an agreement with the Ministry of Health of the state of Nuevo León through the multi-center program, and the only private university in the country listed in the QS World Universities ranking by subject in Latin America. Now that you know about us, explore, choose, unleash your potential.
Good morning, everyone. We hope you are doing fine. We are pleased to ask to turn off your micros and the video to have a better reception of this session, please. At the end of each part of this meeting, we will have a question and answer session. So feel free to write all your questions on the chat to have it ready and we can proceed with that. On behalf of Tecnológico de Monterrey School of Medicine and Health Sciences, we give you a warmest welcome to the Health Sciences Group Annual Meeting 2021, Prevention, Wellbeing, and Longevity, introducing the communications meeting. And this session will be about cutting through the noise and sharing your voice. How to share your voice without publishing a paper. And to begin, I am going to introduce our speakers. Claire Packer is a communication manager for the University of Birmingham, responsible for the promoting the university medical and dental research. Before joining Birmingham, Claire worked for the global Tata Group of companies as well as in magazine publishing. Welcome, Claire. Caroline Durbin is Research Communications Manager for the College of Life and Environmental Sciences at the University of Birmingham. She's responsible for making sure that the research from academics in the college get the share of voice it deserves through all communication channels, online and offline, within the university and external. Prior to working at the university, Caroline has held marketing and communication roles in a variety of industries, including publishing, technology, museums, arts, and the charity sector. Welcome, Caroline. Well, Claire and Caroline, the audience is all yours. You are mute, Claire.
Hi there, sorry, can you hear me, everyone?
Yes.
Right, so thank you for that introduction, Maggie, and good morning or good afternoon to you all. So today, my colleague Caroline and I are going to give you a brief overview of how the academic community can cut through the noise and share their voices without waiting for a research paper to be accepted and published. Carol and I both work for the University of Birmingham. We are aligned to 2 of the university's 5 colleges and work with the University of Birmingham's External Relations Department, which includes such teams as the Press Office and Public Affairs, to communicate with a number of key stakeholders, including staff, students, local community, businesses, research partners, the media, and policymakers. So what do we mean when we say research communications, and why should the academic community get involved? So a large part of our jobs as communications professionals is to enhance the reputation of our university. We want to ensure that our research and our researchers are receiving the impact and recognition that they deserve. On this slide, I've listed 4 reasons how 4 reasons why you should take part in research communications, the benefits that they can bring, and how your university's communications team can support you. Firstly, they can support you to disseminate your research findings. They can help you reach the stakeholders important to your research and thereby help drive citations, increase the visibility of your research, and leverage future funding. Secondly, they can improve your research profile, raising awareness of your expertise to key stakeholders, including peers and funders. They can provide you with your own shop window, so to speak. Thirdly, they can share your research and expertise to the greater general public, whether that's targeting children and young adults through outreach activities, or whether it's running an exhibition or a public talk. Lastly, they can work with you to share your research and expertise with local and national government. For example, arranging ministerial visits or issuing briefing notes so that policymakers are aware of the impact you are creating within your research field. As you can see, ensuring that your research is seen by the most important audiences to you is at the heart of research communications. Caroline will now elaborate a bit more on this and the various channels that we use in the context of cutting through the noise and sharing your voice without waiting for a research paper to be published.
So good morning or afternoon, everybody, depending on where you are. So just following on from Claire, the basics of communications are quite simple. It works well when the right message is delivered to the right people at the right place at the right time. And as Claire said, we work closely with the academics in our respective colleges, and we also work with the wider external relations team within the University of Birmingham who look after the university marketing and student recruitment. Our job really is to make sure that we know about the important research taking place in our colleges. And we work with the academics to make sure that we understand who are the people they want to get this research in front of. So target audiences, as Claire said, can be quite specific. If we've got a particular project which we need funding for and we want to get in front of certain companies or funders, then our activity is very different to, say, if we've got a new dinosaur discovery, which lots of people might be interested in and we could do lots of cool video and media work with. So if one of our academics has got a new paper being published, we'll work with the academics and the media office within the university on a press release, which we'll then send out to the appropriate media. Or if the university is running a larger campaign, Claire and I will suggest the right content and all the right individuals to feature in that campaign. So, for example, a lot of our work is focused on COP26 at the moment. So we're working with a lot of researchers and academics who are involved in climate change activity. But as we say, we don't have to wait for a paper or a larger campaign to get your voice heard. And there are a lot of other opportunities for academics to share their opinions through various channels. So we're going to quickly run through these with you today. And we've broken them down into social media, opinion pieces, events, and videos. And all of these can be used to get your research and expertise seen by more people. Could you click on, Claire? Thank you. I'm going to concentrate a little bit on Twitter for this part of the presentation, although I should note other social media platforms are available. LinkedIn is becoming an increasingly important channel, not only for our business engagement opportunities and business engagement work, but also for just general academic announcements and sharing of news. And like it or hate it, Facebook remains a mechanism to get in front of an incredibly wide audience as well. So spotlight on Twitter for this section. Twitter's mission is to give everyone the power to create and share ideas and information instantly without barriers. And it's an increasingly important tool for a number of academics. It's no longer a place just for chat, but it's also a place for valuable networking. So if you're not doing so already, why make the effort? There are a number of benefits for academics who choose to take part in and kind of work and share their their news and announcements on Twitter. It's a place to promote research. It's a place where you can raise your profile. There's a small graph there taken from a study which states that academics who tweet are more likely to have their work cited. It increases collaborations with peers, and it's an opportunity to learn from others. It's also a quick and easy way to stay up to date on academic developments. It can be a place to build relationships with the media, and we're finding increasingly academics are getting contacted directly via Twitter to provide comments on news items and whatnot. It's a place where you can network with policymakers, and again, a lot of MPs are members of Parliament in the UK are very active on Twitter, and this is an easy way for us to get our work research in front of them. And it's a place where you can immediately publish your ideas. Also, it can open up new opportunities for your work, which you might not have considered previously, because it can be such a vast platform. So Claire and I work with some academics who are very established in their field and feel very confident voicing their opinions and doing so on Twitter. However, we also work with academics and will arrange training for early career researchers who are just starting out and want to know how they can use Twitter to establish themselves in their academic field. So, other than new papers, some other things you might think about tweeting about if you're an academic: events and conferences, your experiences at the university, interactions with colleagues. People-linked tweets generally get a lot more interactions than just sort of institutional announcements. Any awards and accolades for your team. Again, any sort of recognition of other individuals helps to increase reach. And importantly, your thoughts on current affairs or news trends. It can be seen as a tool in your toolkit for becoming more recognised and identifiable in your academic field. This on the right here is an example tweet from Professor Nick Lohman. He's one of the University of Birmingham colleagues who's leading some of the genome mapping work around COVID. And he has managed to establish himself as somewhat of a thought leader through Twitter and his other work with the media. So Twitter can be a vital part of an academic's digital presence. And if you're not doing so already, it is certainly worth considering. Could you click on, Claire? Thank you. So there may be some hesitations from academics and professional services colleagues about taking part in Twitter. You may have some reservations about getting involved. It's just something else to do, and there can be a perceived risk of being opinionated on this sort of platform. However, I would suggest the benefits for engaging can be helpful professionally. It does take some time and commitment, but if you value it, it can be a very useful platform for networking and career progression. And if you're not sure where to start, look to colleagues and peers, take inspiration from what they're sharing. But do remember, academics are experts in their field, and more than ever, people want to hear from scientists. Post-COVID, people are looking for expertise and trusted voices. And this has been reflected from the activity in our media centre. We know that people want to hear from the experts in their field. And also, if anything untoward does happen in terms of trolling or concerning replies, your colleagues in communications will be able to help. There may well already be guidelines within your institution on how to use Twitter, and experience makes it easier. As you progress, you start to recognise that some conversations are worth engaging with and some are not, but it is a useful platform. Back to you, Claire.
Thanks, Caroline. So another channel to consider is writing an opinion piece. This is a channel that anyone can make use of, but particularly by those who may not feel comfortable going in front of a camera. It is also an excellent way for underrepresented voices, people who may not normally be put forward for journalist comment, to share their views. So what is an opinion piece? Opinion pieces, traditionally called an op-ed in a newspaper, give you the opportunity to voice your thoughts and ideas. You'll find them online and in publications, from national newspapers such as The Guardian in the UK to websites like The Conversation, which is an independent, non-profit publisher of commentary and analysis authored by academics and edited by journalists for the general public. Many universities also host their own opinion pieces. At the University of Birmingham, we have several publishing platforms, including the Birmingham Brief, which houses opinion pieces on policy issues. This is sent to a mailing list as well as receiving promotion via social media. There are 4 key things to consider when thinking about writing an opinion piece, and I've listed them on the slide. So first of all, is what you're planning to write about timely? Is it relevant to conversations that are going on at your local pub or your local bar? Are they making the news headlines on the television or in newspapers? Is it something that you have expertise on? Can you demonstrate your credentials if you write about this topic? Will what you have written encourage debate? Will it spark conversation? Opinion pieces where there is no clear right or wrong answer receive more engagement. And is it something that you are passionate about? Is it something that you will stand firm on and share your view from the rooftops? So throughout the COVID-19 pandemic, we have used opinion pieces to share the views of our academic community. As the development of vaccines and their rollout dominated headlines, Dr. Anthony Cox, a reader in clinical pharmacy and drug safety from our School of Pharmacy, wrote for The Conversation on how several rare forms of blood clotting were linked to the AstraZeneca vaccine. This was based on his opinion through his years of his own research rather than a research paper. The second example here is from Professor Nick Lohman, who Caroline just mentioned, so a professor of microbial genomics and bioinformatics and a genomics advisor to Public Health England. He was one of a number of academics who shared their perspective with the UK's The Guardian in the context of how they were tracking the various COVID-19 variants. And then lastly, Pam Cairns, who is a professor of clinical paediatric oncology and the director of our Cancer Research UK Clinical Trials Unit, talked about the pandemic in the context of how it is affecting her own research field, cancer. She shared her view on the implications of the pandemic on patients with cancer and the impact that it is having on the development of new treatments and therapies.
So back to me, we just wanted to say one of the other examples of how you might be able to voice your opinion is through expert comments. So expert comments are another way to get your research in front of new audiences and establish your presence. And an expert comment is where an academic provides a short quote on something which is in the news agenda. So here is a recent example of an expert comment when we were asked about COVID vaccinations for 16 to 17-year-olds. So this one expert comment, which was sent out from our media office, resulted in 25 items of media coverage, including coverage in high-profile media outlets such as BBC and Sky News. So on the expert comments within the University of Birmingham, there's 2 main channels to get these out. Firstly, our media team may send these expert comments out proactively to outlets who they think might be interested in our opinion on a topic, which I believe is what happened with Alex Richter's one here. The other way that expert comments in the UK are sent out is through something called the Science Media Centre. So the Science Media Centre is a UK-based funded body who work with journalists by providing them with information about science and its related disciplines. So since March last year, the Science Media Centre have been in touch with us very regularly, asking if any experts might be able to comment on things like new policies, high-profile academic papers, MP remarks and things like that. The Science Media Centre will then compile all of these expert comments from the different institutions and send them out to journalists. Of course, through the Science Media Centre, this doesn't guarantee coverage, but it certainly increases your chances of having your opinion included in media discourse around your particular area of expertise. So if we click on, So we've got a task for you now, if you don't mind. This is something, whether you're an academic or whether you're working in professional services, if we would like you to have a think about what might you or somebody within your institution might be able to provide an expert comment or an opinion-led tweet on. So if you're an academic, think about something in the news agenda. Might you be able to provide an original comment or thought on this? Or if not an expert comment, some sort of opinion-led tweet. Or if you're a professional services colleague, think again about something which is in the news agenda. Who within your institution might be best placed to give an interesting opinion on this, and what might they say? So any response to this, anything which you could draft together, if you'd like to put it in the chat, do feel free. Otherwise, we'll just leave you to have a little think about that. Should we say 5 minutes, shall we? Does that sound okay? So we'll be back in 5 minutes. So we don't have to share the results if you don't want to. We just thought it'd be a useful thing to have a think about. So just a couple more minutes and then I'll be back on. So I hope that was useful, and you had a little think about what you might say, or if not you, what might have one of your colleagues in the institution have to say about something in the news agenda. So just moving on now to events. On the left here is a quote from a professor of public health and primary care at the University of Birmingham, KK Ching. He gave this quote in one of our alumni university events, and it became a bit of a soundbite for the university. Events can be a really useful way of getting in front of audiences and having your voice and your opinion heard. It's also quite a self-fulfilling thing, in that the more events you do, the more likely you are going to be invited to other events. The same goes for media engagement and social media. The more you do, the more likely you are to continue for that area to grow. So at the University of Birmingham, we've got a busy programme of events, and this seems to have only increased since March last year. Also, we're finding there's an increase in the number of virtual events being hosted by external media outlets. In the top right there, that's a screenshot from a panel discussion which was hosted by our local BBC news station. Dr. Zania Stimataki has been involved in a number of media events and been quoted in a number of media outlets since the pandemic began. So Zoom events can provide a great opportunity to engage with international audiences, which you might not have been able to engage with previously, like today's event, which we're delighted to be part of. And we're finding some people, speakers and delegates, feel a lot more comfortable in virtual events than physical events. And these are actually better forums for useful, valuable discussion and collaboration. Working with the alumni team has been important as well, and I'm sure any of your institutions have got alumni teams as well. And we're finding that these sort of events, which are organised by the alumni teams, are great to get research in front of supporters and advocates, as well as academic peers. And I think probably one other thing is not to underestimate the power and importance of internal university events and virtual forums. They're great opportunities for academics in terms of encouraging cross-university collaborations, which perhaps hadn't happened before. So we would suggest speak to your communications team or your alumni team or your university events team about how you might be able to take part in these sorts of events. Over to you, Claire.
Thank you. So the last channel that we're going to cover today on how you can cut through the noise and share your voice without waiting for a research paper to be published is videos. So we've got a nice statistic there at the top. So did you know that in 2019, the number of digital video viewers worldwide amounted to over 2.6 billion, and that number is projected to reach over 3.1 billion in just 2 years' time. So we use videos extensively at the University of Birmingham to promote our research. We have published short talking heads of just a couple of minutes on our website, as well as taking part in social media channels such as Instagram stories and Facebook Live. We find that they're a great way of explaining complex subjects, helping to show the person behind the research and breaking down any perceived ivory tower barriers. I'm now going to hopefully play just a couple of minutes of a video that was recorded by Alan McNally. Alan is a professor in microbial genomics who was seconded to the UK government's first flagship COVID-19 testing facility as lead for infectious diseases. Alan has been one of our leading expert voices at the University of Birmingham throughout the pandemic, as well as authoring opinion pieces and engaging with local and national journalists. Alan has recorded several videos. The first one, which was recorded and published on the 13th of March 2020, has now received over 500,000 views. The video I'm about to show you, Alan recorded as a 6 months on What Have We Learnt About COVID-19 Explain a video. So as you will see, Alan is someone who has been actively involved in COVID-19 testing, and he has been sharing his opinion as a trusted expert source.
Sorry, Claire, we are not listening the audio.
Sorry, could you read the subtitles? Are they visible?
Yeah, sure.
We have it with the subtitles. Thank you, Claire.
Okay, I'm going to pause the video there as sadly you can't hear it. But as you can see, Alan is delivering it in a very informal, relaxed style. He's there seated at his desk, and he is using such phrases as I believe and I think. So he's very much showing his own expert view through his experiences, what he has learnt, and they are his belief.
So just some closing thoughts really on the presentation. So we hope this has been a useful oversight of some of the communication channels which should be available to you in terms of getting your voice heard and getting your opinion on the areas which you are comfortable giving an expert opinion on. So the takeaway from this, we hope, will be that that being opinionated and sharing your voice can help you professionally, but also help your institution. And also there are lots of communication channels and opportunities for you to explore. And your communication colleagues may be able to help you to identify those opportunities. Some of the channels which we've suggested you might feel very comfortable with, some of them you might not, and that's absolutely fine. But please know that people are interested in what you have to say on your expert subject. So that's it from us. So if anybody does have any questions, please do let us know. Thank you.
Claire or Caroline, is there, besides you that you manage all the communications for research, do you have another department that goes around all the university to wrap up all these things that the research people do to the university in between? I mean, all over the university with the research part?
Yes, so both Caroline and I are communications manager. So we are the link really between the academic community within our own colleges and then the wider university. So Caroline and I coordinate that activity. We find out what research is taking place. We support the promotion of research papers, as we've talked about just now, promoting expert voices and opinions. We help to promote funding bids, so where we can support that application. And then we work with the wider team, so whether that is with our press office, with the central events team, with the schools outreach team, for example, to then do what we think is appropriate to help that researcher and in achieving their goals.
Thank you. And do you have any internal media that you can use to promote them?
We're quite lucky at the University of Birmingham. We've got our internal communication channels and media are pretty extensive. We have hundreds of thousands of followers on our social media channels, and our website gets something like 5 million views a month. So we are quite lucky in terms of, through our own internal media channels, we are able to get that reach. But as we said in the presentation, a lot of the time, the audiences we need to reach can be very targeted and very niche. So we need to be a bit more creative. It's not so much about getting to millions of people. We want to get in front of, you know, a few key decision makers at trusts and foundations. So that's where the different channels can be beneficial for that.
Yes, that's true. Thank you. Yes, because the research area is very, as you said, is very narrow. So we have to focus in many people that we can reach, but not all the people are interested in what we want to send. Yes. Anyone in the audience would like to make a question or comment?
Ines says, thank you for the great presentations.
Yes, okay. Well, along the next presentation, we can also do any questions to Claire or Caroline. Okay. Thank you very much. That was a wonderful presentation of both of you, Caroline and Claire. Thank you so much.
So should we pass over to Maggie now? So Maggie Espino Barros is Director of Communications and Public Relations at the Tecnológico de Monterrey School of Medicine and Health Sciences. So over to you, Maggie.
Thank you so much, Caroline. So let me share my screen. Okay. Let me do it quite well. Okay, can you see it now? Yeah, thank you. Well, along what Claire and Caroline talked, I would like to add a little bit of what our school is doing, or Tecnológico Monterrey is doing. So first of all, I would like to share who we are, that we belong to Tecnológico de Monterrey. That Tech has 6 schools, and one of them is our school, the School of Medicine and Health Sciences. And besides, we belong to Tecnológico Monterrey. Oh man, I can't. Okay. Tecnológico Monterrey has Tech Salud, which is the Tecnológico de Monterrey Health Science System that incorporates innovating clinical, academic, and research services to the medical academic centers. One of our main purpose or our advantage, we have a hospital that belongs to Tecnológico Monterrey. We have the Zambrano Elion Hospital. We have the School of Medicine. We have the San Jose Hospital, and we have healthcare institutes, and we have the Tech Salud Foundation. So we have a whole center where we can have the academics, the research, and the clinical. So in this, when COVID started, the San Jose Hospital turned into COVID hospital. We find that was the best thing to do, to have one hospital dedicated to COVID. Now it's doing a lot of more things, but everything went to COVID and all the other areas went back to Zambrano Hospital. They are both in Monterrey, Mexico. And we also have an alliances with the Ministry of Health, with different public hospitals. So that allow us to do many things with the health system and to work for a better community and also in the public health. Our School of Medicine and Health Sciences is divided in 3 regions. We have the Mexico City one, in Monterrey, the one that was born, and we have the West region, that is Guadalajara and Chihuahua. In all of them, we have the different programs that we have. And then I am going to talk about what we were facing during COVID, as all over in the world were facing. But the priorities for Tecsalud became to minimize disease transmission, to care for patients, healthcare professional, employees, faculty, and students, maintain the health system, the healthcare system, and reduce mortality and morbidity. So I wanted to show you how we are composed in Tecsalud. We have a different, like in Birmingham University, we have also the communications and marketing departments, national, and also we have a communication and marketing team in Tecsalud. That's the director for communications, and we have communication manager, a product manager, consumer experience manager, me, that I run for communication and marketing for the School of Medicine and Health Sciences, and the marketing manager. So we all work together to maintain everything as one thing, that Tecsalud or health system is one in Tecnológico de Monterrey. So what we did in research, what we do is that besides the articles or the presentations that the research have, we try to do, as Caroline and Claire said, to do something else besides the paper, to publish a paper. So what we do is that we have interviews to have all these different things that the research people is doing and make it in a regular basis so that people get to understand what they are doing. Because if we do like a clinical type, well, the people is not that into the words or something. So we try to make it as clear as possible so any person can understand what we are saying. And also, besides the people that we have in research, we also promote our alumni. For example, Lisandra, who was our student, now she got a grant to do a research thing. So we try to do in Instagram, in Facebook, Conecta is our media in Tecnológico de Monterrey. And also we have Tech Review, which is a magazine. And also in Tecnológico de Monterrey, they do this big event when they give a grant to the group or the person that has a great publishing or something that they develop. So one year the ophthalmology group had one of that prizes. So we have different things that we can do among all the people and to have the advertising for the research area. In our case, we have 8 different groups for research. So ophthalmology and cardiology and other ones, cancer, breast cancer, and different ones. So we try to give an impulse to each of them. And besides that, what we did is we have a landing page. So we have all the research in health, and we promote what we are doing, that we have, how many students we have, how many publication projects and all that things. We are changing that every week or every month to see what's going on, what's new. And we have also the research groups to show the people what we are and what we do, and also to contract or to have more people joining our groups. And also for the facilities that we have, or for the industry, the pharmaceutical industry, that can give us grants, or we have CONACYT that is from the government that supports some research. So we want all the people and the different areas and industry to know about what we are doing so we can promote that. And for that, we have a recommendation for all the researchers that for that, sometimes they think that you are going to have all the information that they are doing, but sometimes we don't know that if they are going to have a prize, or they are going to go to another city to have a publication, or to go overseas to have other things that are very important. So first of all, we need to know what you are doing so we can help you out of what you want to do or how to promote you besides your publication, to promote you as a researcher. So we need you to follow social media, to reshare posts. If you have someone that you like what they are doing in research, if you share their posts or do comments or do something like that, then you can be involved in that relation with all the area or the topic that you are interested in, and also be yourself. We want you to be in social media and LinkedIn or all of that, to be who you are and to demonstrate what you do in a simple way, because that's the better way to show the world who are you and what you are doing. Also, when you do a post or you want to say something, try to put hashtags along with the topic that you are talking about. If, for example, you are talking about cancer or cardiology, you can do hashtag cardiology or hashtag Birmingham University or TechSalud or whatever. So that makes that you can positionate yourself in another areas besides your school or besides your institution. And also a very important thing is to approach the communication department, because we have many things going on and we want everyone to be in focus and to be promoted. But sometimes we miss something that is going on and is very important. So it's very helpful to have you letting us what you are doing so we can do something else to make it better for you. And well, besides that, then I'm going to tell you about what we did during COVID-19. So Tecnológico in Monterrey was one of the first universities to move to virtual classes, to a digital flexible model, 100% online when COVID started. And the School of Medicine made some guidelines for an action plan. We have to move very fast, as you all did. So we have 4 things that were very important for us: protection and safety for the educational community, academic community through distance education, communications and follow-up for the academic community in order to mitigate the anxiety, uncertainty, and loneliness of students, faculty, parents, and the support staff. That's what we are going to talk about now. And also response and social responsibility as part of the medical health sciences mission. So about the communication for to have the people well-being and to be okay with this situation, but because no one was going out or anything, and we are going to change so fast or so quickly in another time or another type of education. So Tecnológico de Monterrey first built the Consejería Virtual, that's been advisory group. So we have a big group that was the advisory group to be in charge of the well-being of all the community for Tecnológico de Monterrey. It was nationwide. It was into medical, nutritional, and psychology advice. Those were the 3 main ones. Now we have many others, and we are watching over all the people and all the things to be in well-being. So first of all, in the school, along with the advisory group, we have a free virtual psychological counseling clinic nationwide. What we do is that virtually they have a person that needs some advice or needs some company or something, and one of our students is the one that contact them with the counseling and of the staff, a psychology professor that has to be with them, so they are doing the right thing with the person that is asking for help. So we have 75 students the last period with 10 teachers and 3,000 hours doing this counseling or this psychology advice. The thing is that at the beginning, the people was kind of afraid to call and say, listen, I have a problem, or I don't feel myself anymore, or whatever. So it's not easy to do that. But we try first by telephone. Would be easy that if they don't see you or you don't see them, they feel more comfortable. So we started with a line, with a telephone line, and also by Zoom. So wherever they feel comfortable, then we start doing this psychology consulting. And the services that they did were for anxiety, depression, and grief for COVID. It's a lot of people suffering from this even now. So we try to do the best. At the beginning, it was only for the people in the community, in the university, or the faculty, or the staff, and then it spread all over. So not only for the students or for people anywhere, if they need something, we can help them. Also, we have an academic societies. We have like different groups where the students belong to these societies and they have a mentor. So with the mentor, what they did, different activities to help all this situation and well-being for the people and the community. So they did first aid psychological activities. The week Te Queremos. Te Queremos is we love you. It's something that Tecnológico did, and we have a web page, and we have Te Queremos, and it's when you want to have an activity, for example, yoga, or for mind, or for mindfulness, or for taking care of your health, or whatever, we have this site, Te Queremos, and we give conference, wellness, resilience. So what we want is that the people to be happy, to be well, to be healthy in this situation, because not only physical, we also have to have our mind very clear and very in an equilibrium, so we can do all the things that we are doing in a daily basis. And also they have assessment week, so they gather and see what they did well and what they will do next steps to keep helping all the people, not only because of COVID, because we are doing in a transition right now. So maybe we don't have as we did back years, but we have a different normality. So we have to adapt and go into that process. So we have all this along all the way with all the students and all the professors, and also discussion panels to have us consulting, or to have a staff giving advisory for all these groups that are helping all the people. And for example, for promotion, to spread the word, at the beginning, we were doing things like put your face mask, or wash your hands, or all the dress code, or whatever, or how to use all the time gel, or whatever you need, and for doing this pandemic. And also videos, like for example, we wanted the students to do this kind of thing, so that young people could understand and could also do something for themselves, because I don't know if your countries did that, but in our country, the young people were the ones that thought that nothing happens, and they were doing parties and still gathering and all that in groups. So we tried to fight for the young people to understand that it was a very difficult situation. So we start doing videos, or doing posts, and we use all the social media, and also we did testimonials and all that, so that people can get engaged with what the health system was doing for the community. It was a very great opportunity for us to spread the word and to know us, and to know that we can help all the people and all the communities that are around us. See, we start with stay at home, or our doctors are our heroes, or here, watch your emotions through COVID. And also we have videos that not only you are passing through this, so there's many people doing this. So we have videos with these people, and also healthcare professionals to tell them, like psychologists, to tell them that you are not alone. We are here with us. So we did all this advertising and a whole communication strategy. This is only a few examples, but we did a whole communication strategy and marketing strategy to help people and to be going step by step along all the way that the things we're doing and all the things that were changing along the way that we were building and we're constructing along every day. So, and for example, this Cuida tu mente, that's Watch Your Mind. This is one of the virtual advisory that the psychology students did along COVID. So they said, if you have questions and you need help or whatever, we can help you. And so we have the Monterrey region, the West region, and also Mexico City region. So we cover all nationwide. So we can help them, even the students or the parents or the families or whatever. At the beginning, we were doing this only for the Tecnológico community. But when we saw that at hospitals were a lot of people in the waiting room because they didn't know what is going on with their families or whatever. So we start doing this also for the families or relatives or the patients. And we also have these screens on the hospitals, so we can have all these things also going on the screens and giving advice or doing some tips so they can know what to do or what to expect when you feel lonely or when you feel depressed because you have a family that is not doing well. So we started with all the community, and then we also have workshops for students, because the thing is that the students that we were given the counseling or the advising also needed help to cope with themselves, and then they can help all the other people. So we promote these workshops for them, and there were several of them. And also this was a very important workshop that we did with the Ministry of Health for the residents, because they were the ones that were in the first field. So it was very important for us to have all our residents that goes to the different hospitals that we have, and also the public hospitals that we have agreements with, to be prepared and to know that you are human. Besides you are a doctor, you are a human. So you can have this kind of trouble, or you can have something that bothers you, and we can help you out, or the people that is in charge can help you out. And this is what we did also, is the website Te Queremos. This is the one, we love you. So there's also mails going on with the information of, if you want to save a life, what, ask us, and you can save it. We have a program that is QPR, that it's a question and responsive and all this for helping people in the community. This is for the Tecnológico de Monterrey community. And also we have No Estás Solo, hay más personas a tu lado. That means you are not alone. There's more people besides you that can help you. So we can prevent many things that can happen with the people. Also interviews, or in the newspaper, we have interviews to the psychologists and the specialists. So we can tell the people that it's normal to have this kind of depressions or this kind of things that are going on. So we wanted the world or the community to know that Tech Salud was there to help them out, and mostly in the psychology area. And also this is Watch Your Mind, and it's another website for Tecnológico Monterrey. So if you have any trouble or any question or anything that you need, you can enter this site or this one. So they can help you out to cope with all these things that are going on. And also we have the Conecta. It's the one of our media communications. So it goes all over. It's not only for Tecnológico Monterrey, it goes all over. So the media can have some information from our Conecta, and they can distribute it to another newspapers or to the TV or to the radio. So we can have more people involved in this and to know what we are doing, and that we can help them out to go through this pandemic or to this station that we have now. So thank you so much. I hope you like that presentation. And I don't know if you have any question or any comment that you would like to add. Oh, thank you, Dr. Diaz.
I have a question, Maggie.
Okay.
So for the future, so your kind of your communication strategy, are there any things that you've learned over the last 18 months that you will then add into your communications in a strategy? Anything you will do differently?
Well, yes. First of all, that we have to do all the things virtually. So that's the first change. And the other thing is that you can do many things as you want, as if you are creative, or the group or the team that you are working with have many ideas, and you have to switch some things. We change all that. We have this strategy to promote our programs and our specialty programs, but beginning that, we have to switch that and stop promoting the programs to start doing statements of what's going on in life, and to change all the promotion to wellness, well-being, longevity, and all that. That's why Tech Salud is now the vision, the mission that has is wellness, longevity, and prevention. So we have to switch all that word that we have for promoting the school or the programs to promoting well-being, and to promote prevention, and to understand the person, to do the things on the shoes of the person, that how are the feelings of the person that is going to see us, or that is going to share something with us. So that's what we see different, and we have to manage differently. We have to start all over again with some other strategy. Yes. Thank you. If you don't have any other question, I don't know if you want to do something else, Claire or Caroline, or no? Okay. Well, if not, I think we are all finished here, and we are very glad that you join us for this communication meeting, and a very important team, our topic. And I would like to thank Claire and Caroline because they invited me to participate in this session. So thank you so much for having me here.
Thank you for letting us speak at the annual meeting. It's been very fun to take part and meet you all.
Yes, thank you, thank you. And well, on behalf of Tecnológico Monterrey School of Medicine and Health Sciences, thank you so much for being here, all of you. And we hope you can continue with other sessions here at the U21 Health Sciences Group meeting. It will be very nutrition for everyone, and it will have a lot of things and interesting things besides communications and all other academics and other topics that will be very important for you and for us to learn. Okay. Have a very good day, afternoon, or night for everyone. And thank you so much for the support team also.
Thanks, everyone. Bye.
Bye now.
Thank you so much. Listo.
Listo.
Eve, ya estás. A ver.
Creo que nada más quedamos tú y yo.
Ok, Eve no está, ¿verdad? Ah, bueno. Qué lástima que, digo, por mí no hay ningún problema, digo, no pasa nada, pero por Claire y Caroline, que ella te iba a hablar en inglés, que éramos como 57 y que fueron mucho menos los que participaron.
Sí, fueron muy poquitos.
Sí, qué triste. Digo, ojalá que lo puedan ver porque ya ves de que lo vamos a tener. Aquí va a entrar Eve. Porque lo vamos a tener ahí en la página, ¿verdad? O sea, lo van a poder ver. Estábamos viendo